was very traumatic being in that state, and even my friends and my family, it was very traumatic for them too, because I didn't look like me. I was over 200 pounds in water weight. I could barely walk. You swell so much. It's not fat, it's just so much water, because you get a lot of lymphedema, because your lymph nodes aren't working properly. So you tend to retain a lot of water, because also your kidneys don't work very well because you're on a steroid. Prednisone is very, very effective, and it's very fast acting. But like I said, it does a number on your body. So again, it's not an easy drug to be on and to come off of. So it took me about 1.5 years to be taken off that drug. And during that time, I started developing POTS-like symptoms. At the time, they thought that maybe it was possible withdrawal with prednisone, so they didn't really think anything of it, so they put me on a water pill, which helped with the lymphedema and the water retention and swelling. When I was fully off the drug, I was on that water pill for about 3 months after, and then eventually I recovered. At that time, I also had to have a lot of injections for calcium, and basically my bones were so weak. I was very at risk for breaking a bone and whatnot. So those were all things that I needed to be on when I was coming off the prednisone. And then when I was 25, this was after I was completely off the prednisone, I started having awful attacks in my chest. I would wake up with my heart feeling like it was racing so bad, and it would wake me out of a sleep. At first I thought maybe it was due to nightmares or anxiety. So at first I didn't really seek medical attention for it, because I thought I was just really anxious. I was going through a lot. So I just kind of brushed it aside. I would often breathe through these episodes quite a bit, and talk myself out of them. And oftentimes they would clear up, but they would happen almost every single day during the day, and almost every single night. And it was getting to the point where the episodes would last an hour, and I couldn't get my heart rate to come down, and I started feeling like I was going to pass out, and I couldn't get my breath in, and it was starting to scare me. So I ended up having to go to the hospital. My boyfriend at the time took me to the hospital, and they immediately admitted me right away. My heart rate going in was 240 beats per minute, which is insane. And I remember the nurse looking at me and going, "You need to lay down, like you're gonna pass out." Like, this is, like, she was so scared. And so she put me on a stretcher, and they immediately wheeled me into the back. My heart rate would constantly go up and down, up and down. It would come back down to about 100 beats per minute, and then it would skyrocket to 240 beats per minute within a matter of seconds. Every time this happened, I had this almost adrenaline rush feeling, and I couldn't lay there. I felt like I had to get up. I felt like I had to go for a walk. And I remember telling the nurses this, and almost laying down felt worse for me. And I would often like yell for something cold on my face, because I felt so hot all the time when this when my heart rate would spike. I didn't know then what I know now, that it was my body was actually having a problem with the release of adrenaline. And what I know now is it was the beginning stages of my POTS disorder, which I have. I've been formally diagnosed with dysautonomia. But at the time, we didn't know that. At the time, the doctors had started me on a beta blocker to help control my heart rate. And that helped. I was on that for a number of years, and they just basically said that the reason why this is happening is because I have a small hole in my heart, which I was born with. And most likely when they did the echo, they found that I had a tiny hole in my heart and that my heart was having a hard time regulating blood in one chamber of my heart. So it would just start freaking out. And so, but it wasn't a serious enough condition that would warrant me to have correctional surgery or anything like that, that it could be controlled with medication. So they had started me on atenolol, which is a beta blocker. I had been taking 50 milligrams a day, and I took it for a number of years, and my heart rate basically returned back to normal. Although oftentimes I would get these weird, almost fainting-like flushing feeling out of the blue, and those never went away. I was lucky enough then that I didn't pass out. I knew enough to sit down, and then it would pass, the feeling. So I just thought maybe it was because of my heart condition, and I just kind of left it at that and lived my life until I got into my 30s, which is where I'm at now. So let's rewind a bit. I'm 35 now, so we're going to go back a little bit before we get into what's going on now. When I was 30 years old, I went and saw a gynecologist, a gynecological surgeon, who finally did my first resection surgery for endometriosis. There, I was formally diagnosed with stage 4 endometriosis. There, I was told that when she did my surgery, she opened me up, and it literally looked like my insides had been thrown into a blender, pulsed a couple times, and thrown back into me. It was one big, huge ball of a mess. That took her 6 hours. The surgery itself was a very hard recovery. I was in a lot of pain. My bladder did not work for about 3 weeks after surgery. I was catheterized because of all of the endo that was on my bladder. It basically took my bladder some time to heal, which is not unheard of for endometriosis. This often does happen for some patients who go through resection surgery. They may see a catheter in their future. So I was told that that would most likely happen, but usually in those cases, it's temporary. So, which it was. So I was in the hospital for 3 days after surgery, mostly because my bladder was not working and my pain levels were just skyrocketing. They were trying to control my pain enough so that they could send me home. So after 3 days in the hospital, they sent me home with my catheter, and I had an at-home nurse for 2 days. My mom stayed with me. This is all when I was living in Toronto, and I had a roommate at the time, and he was a supportive friend, and he was there to help me, and my mom was there for a couple days, and then finally, after 2 days of being at home, my mom went home for a bit, and I continued to heal the best I could at home with a nurse that came in to change my catheter and just check on me to make sure that my incisions were healing. So I will also be adding some photos here of my incision. and my catheter. So these were all things that weren't that bad. I got used to the catheter, and I kind of had a system going. But then things took a turn for the worst again. After about the 4th day of being home on my own after surgery, so this is about a week after surgery, I developed a high fever, and these violent shakes, and severe back pain. I ended up having to jump in a cab to the hospital and had an MRI done because they were worried that I could possibly have a bowel obstruction because of the work that they did on my bowel. In the MRI, it showed that my one ureter was a little thickened and that it would possibly be the starting of a infection in one of my kidneys. They were also a little bit worried about my colon because it was quite thickened. And at this point, I was not going to the bathroom. I was on a lot of medications for pain, so it wasn't really a shock to them that I wasn't going to the bathroom. And also, I was still healing from major surgery. So I was admitted, and I was there for another 6 days in the hospital. I was on quite a bit of medications, a lot of antibiotics, a lot of anti-inflammatories and whatnot. I was also on a diuretic at one point because I just wasn't going to the bathroom as much as I should be. But basically it came back that I had quite a bad infection in one of my kidneys that could have most likely come from the Foley catheter, but they don't know completely. Either way, I was there for 6 days. So overall, I was in and out of the hospital for almost 3 weeks at one point from surgery. Fact is I'm on immunosuppressants for my Behçet's disease, but they did instruct me to have me come off of them during surgery so that my immune system wouldn't crash too much so that I could heal properly. So I had been off of all of my formal treatments for autoimmune, but because my counts are never really normal to begin with, I don't have a very good immune system, so it's not unheard of for me to have complications after a procedure like that. So that being said, I eventually healed, and it took a total of, I think, 8 weeks completely for me to heal enough to return back to work. So at the time I was working at as a hairstylist, and I was working a lot. And in that year and a half after surgery, I would say my pain had went from a 10 to about a 5, which is amazing. It was a lot better. I had noticed a huge difference in pain, and even my bleeding. In my eyes, the surgery was a success. Unfortunately, another year had gone by, and my symptoms were starting to return back, and it was a little bit of a letdown, unfortunately, but we kind of knew that it would return. Endometriosis surgery is not a cure for it. If anything, it'll slow it down. So after all of that, with the pain specialist and the treatments for breakthrough pain, I wasn't on any narcotics full time. I was only on it for breakthrough reasons, like breakthrough pain reasons, just for my really bad days. So during this time, I was getting a lot of weird GI symptoms again, and my GI symptoms seemed to get much worse, and I was having a lot of allergic reactions, a lot more than usual. My seasonal asthma seemed to not really respond well to the puffers that I was on. I was constantly having my joints feeling very clicky, and I was having problems with slight dislocations with my fingers, which would happen throughout my life, but they seem to be aggravated much worse during this time. So, but the main concern was my GI and getting my pain under control. So one day I woke up, I was getting ready for work, and I started passing blood from my bottom end, and this happened to me one other time before, but not quite this much. This seemed to be quite a bit, and it was alarming. So I ended up going to the hospital, and they ended up admitting me for a couple days for a small lower GI bleed, because my hemoglobin had taken a little bit of a dip. So they wanted me more so to stay so that they could watch, just in case if it had dipped too low. Also during this time, I was extremely neutropenic, and they were worried about an infection, so they started treating me for an infection. And at this time, there was quite a bit of thickening in my colon, my lower colon area around the sigmoid, and I wasn't going to the bathroom very well. I wasn't able to pass very well. Gas was being trapped. It would just build up, and I couldn't get it out. So they kept me for a few days on antibiotics, IV antibiotics, and fluids and IV nutrition, because they had me on a clear fluid diet, and put me on bowel rest. So that was that. I was in the hospital for about a week. Came out, started working again, was feeling okay. Still not feeling 100%, but well enough to go back to work and carry on about my life. A month goes by, same thing happens. I start bleeding again, and my colon is just not moving. I start taking laxatives, milk of magnesium, peg light solution, and nothing didn't really want to work well. So again, they had admitted me again for another week. At this point, they had started me on jugs of peg light, that colon cleanse, and they decided to do a colonoscopy. So they went in and did the colonoscopy, and at that point, they had seen that I had a large kind of turn in my sigmoid colon, and I was showing pockets forming. Diverticulitis. So that was basically the answer there for the slight infection that I kept coming into the hospital for. So, but there was no answer as to why I was having a slower bowel than usual. So this continued to happen over the course of a year. I would constantly go in and out of the hospital because my bowel just didn't want to move. I would be bleeding from my rectum constantly, even though I didn't have any hemorrhoids. Now it was later determined during that sigmoid scope that I did have hemorrhoids, but they were much higher up, and that was why I was bleeding. So it wasn't your typical hemorrhoids that you would get. And this is why I didn't think I had them, because I didn't have the standard symptoms to external hemorrhoids. These were much higher up, which I was told can be more dangerous because of the fact that you're bleeding higher up in the GI, but still low enough. It's still harder to stop the bleeding. So that was that. I was treated once again for the same symptoms, and at this point, I was bounced around through a couple of GI doctors that really didn't know what was causing this, and The big red flag was when I had my first blockage, and continued to have blockages. Mind you, they were able to clear them, but there were a couple close calls there where we almost had to do surgery. So this is where we get closer to where I am today. Over the last 2.5 years, my colon has been slowly shutting down, mainly on the left side. I now have paralysis of my lower colon from, basically I was told a couple weeks ago that I'm in the beginning stages of colon failure due to complex dysmotility disorder. Now, about 1.5 years ago, I was also diagnosed with gastroparesis because I was having problems keeping food down. Now, the gastroparesis that I do have is mild, and it is most likely due to the fact that my colon is so slow, that food takes a long time to go through my colon, and oftentimes gas buildup and pressure in my gut is pressing on my stomach, so therefore my stomach is not able to move properly. So I often, when I'm in what I call a really bad flare with my gut, I get cycled vomiting, which has led me to lose a significant amount of weight. I am now just barely at a healthy weight for my height and my age. And I still struggle to keep weight on. Mind you, I would say the last 6 months I have been able to either just maintain or I bounce from like a loss of 4 pounds to gaining 2 pounds. So I'm constantly fluctuating. But I'm very malnourished. Because my gut does not move properly or really work properly, I'm told that I'm getting about maybe half of the amount of nutrients I should be receiving from a normal functioning gut. So my blood levels are a constant problem because of that. And because of the lower GI bleeds that I'm constantly dealing with, my hemoglobin is always low. So I'm going to be starting IV nutrition and IV iron. I'm still waiting for the call to get started with that, but because of COVID, everything has been delayed. And now I'm looking at the possible diagnosis of EDS. And most likely, in my particular case, it won't be type 3. I'm told it is most likely classical EDS, as a lot of what I have is involving a lot of organs, in particular my GI tract. There's not a lot of good scenarios in my case. I was told 2 weeks ago that I'm being sent to a motility specialist that specializes in surgery with EDS, and we are looking at a number of scenarios that may play out over the next few months. Either I'm going to have my colon completely removed, even though one side is still functioning. The concern right now is most likely the rest of it will fail, because there's so much pressure on those other parts that it's just a matter of time. The other scenario that we're possibly looking at is most likely, if we can't do that, then we look at other alternatives like tube feeds or IV feeds, which are not ideal. We would rather not do that because it can also put strain on the liver. So this is why I need to be seen by this particular specialist, because we just don't know what to do yet. We know that the colon is virtually not working. So basically, I am stuck with taking a lot of meds, a lot of motility meds, a lot of jugs of Peg Light, milk of magnesium, and lots of fluids, and eating a very bland diet of rice, overcooked rice, oat milk, and fluid-like foods, because I can no longer eat a lot of foods. I can't eat meats, I can't eat fats, I can't eat vegetables and fruits. I can eat very little of those, and from what I can eat out of those fruits and vegetables have to be cooked or pureed, and they can't be high acidic foods. So yeah, there's a lot of changes going on in my life, and this is why I've been very quiet and have not really updated this channel in a while, but I want to start re-uploading and telling my story, because I think it's important to talk and to keep people educated on genetic conditions, connective tissue diseases, and of course endometriosis. These are all very hard diagnoses to deal with, and you know, it's not an easy life to live like this, but this is my life, and I've been living it for this many years now. I'm 35, and I am a true believer in talking and spreading awareness, and I do not give up. I am very stubborn. So I will continue to try and upload at least once a week. I'm going to try once a week, and you know, I don't want to only just do medical uploads. I kind of want to do some vlogging, and I'm a musician and an artist, and I may even share some of my music. But for now, I think this is a start, and I wanted to get this out so that the people that have subscribed to my channel at least know what's going on. So hello and welcome, and thank you for subscribing. The support is wonderful, and I look forward to sharing with you guys many stories and many other treasures. So in the meantime, I shall leave you with this. Please like, subscribe, and share this video with anybody that could possibly be going through something like this, and know that you are heard and you're not crazy, and to continue talking and telling your story, because it is important to be heard. So in the meantime, everybody stay safe, and thank you for watching. Bye.